Hey YouTube, it's your boy Eccentric here, aka the Optometry Prodigy, and I'm coming at you with another video. I would just want to like to thank you all again, liking, subscribing, commenting, sharing. I really appreciate it. Before I start the video, I want to make mention of the new Instagram and Facebook pages that I've created to support the channel. You can go there. I'm going to be posting quizzes, and I'm going to be posting fun facts. I'm going to be posting a whole lot more on Facebook and the Instagram pages. You can find them in the link below. Follow, like. You can even communicate there with me as well. It will be easier to answer questions also. So let's get right into the video. Today's video will be based on crossed eyes or Cokey eye, but the medical term that we use is Strabismus, and this will be under public education because it's really more for the general public and not necessarily for students or optometrists. So Strabismus, as I said, it's a medical term that we use when the eyes are misaligned. So an individual may be watching an object, and one of the eyes will be focused on the object and the other eye may be out towards the left, in towards the right, up, or even down at times. Sometimes there are other cases where there are rotations as well. So as we can see with the child here, his right eye in particular is turned in towards the right. So there are cases where we would see it in children. As we can see with the adult here, his left eye is turned inwards. So we can see it both in cases with kids or even adults. And also we have what we call pseudostrabismus or fake strabismus. It just appears as though the person has strabismus. So as we can see in this case here as well, we can see his left eye. It looks as though it is turned inwardly, but it's not. It's actually that little piece of skin there, what we call the epicanthal fold. So that piece of skin, that fold, is making it seem as though the eye is turned inwards. So some symptoms that people may experience with strabismus, they may have what we call head tilts, they may get headache, they may have visual discomfort, their eyes just feel uncomfortable when they are reading or looking at something for a long period of time. They also get what we call double vision, or they see two objects at the same time. And as the day progresses, most likely the symptoms get worse. As we know, symptoms would mainly be for the adults. Kids won't tell you about their symptoms most likely. So how can we identify or take note of strabismus in kids? So identifying the strabismus in kids especially. Sometimes they won't complain of these symptoms, as I mentioned, headaches, double vision. They may not say these things, and in cases some of the children they aren't able to speak as it more towards the babies or the toddlers. So what we do, we can observe, simply observe the child. What can we see here? So we have the white part of the eye here, the white part of the eye here. The eye looks, it appears to be centered. Everything seems fine on this side. However, when we look at this side, there's a large part of the white here. The white on this part is a bit smaller. It's less here. And the eye looks, it appears to be deviating, or as we would say, it appears to be outward. Another thing we can do, that as we did there, that was simply observation. So it appears to be outward. Let's find out if it's really outward. In that case, we can simply take a pen light, and this is what we would do in clinical settings. We take a pen light and we would shine it about arm's length away to the center of the face, shine it about arm's length away, and when we look at the reflection that is seen in the pupil here, the darker portion, the center of the eye here, we see the reflex, and this reflex, it appears to be at the center of the eye. So that's okay, that's great. However, when we look at this eye, the pupil is over here, while the reflex is more on the brown portion of the eye. This is the reflex here, this white dot. So as we can see from those two cases, with the observation, this eye appeared to be outwards, and even with our Hirschberg test, as we would call it in clinical settings, or simple use pen light, we can see that the reflexes are also off the eye. So those are simply two ways we can look at the eye if the person isn't mentioning anything about symptoms, or if it's a baby who won't really say anything because they can't speak as yet. So now that we have defined strabismus and we've looked at the signs and the symptoms, what causes strabismus? So most likely in the case of kids, strabismus would most likely be caused by some form of muscle dysfunction or some kind of muscle problem, or even nerve problem, possibly facial deformity or some kind of facial or an anatomical problem with the face, or especially around the eye sockets, or even trauma to the eye. So most likely these cases would be at some time around birth or during birth, or even as the kid grows in the developmental years, as we would call it. In adults, however, some of the causes would be strokes, diabetes, trauma, thyroid issues, anything that will cause problems to some nerve function or muscle function. So let's have a look now at the treatment options. But I must make a disclaimer before we go through any of the different types of treatments. A binocular vision assessment must be done by a certified practitioner before any of these treatment options are selected. So let's go through the different forms. So firstly, we can have issued spectacles or contact lenses over the patient's eyes. This will help with specific cases of strabismus. We can also use prisms. Prisms help to bring the image or the object that the patient is watching rather in alignment to the eye. So the eyes is not being straightened in this case, but rather the image is being aligned so that it can be picked up by the eyes. Also, we can have vision therapy, or what we call orthoptic exercises. This may be required to converge or bring the eyes inward, or in cases where the eyes are already inward, they can be used to diverge the eye or bring the eyes outward. So possibly in another video we can go through some of the different methods of orthoptic exercises, or vision therapy as we call it. But for the sake of this video, I'm just going to mention a few. I'm not going to go into the explanation. That will be more for the optometry students and the optometrists, etc. So for example, one of the eyes are turned outwards. We can use what we call a Brock string that will help with convergence or bringing the eye inward. It will also help with the accommodation of the patient. In other cases, if the eye is turned inwards, however, we can use what we call eccentric circles to help do exercises to bring the eyes outwards. At the end of the day, the eye has muscles, and this is mainly what we are using to realign the eyes. We are basically working the muscles, getting them stronger, or getting them weaker in certain cases to realign the eyes so both of the eyes are straight. For the sake of this video, again, we're not going to go into the explanations. We'll do that in another video. The other option of treatment we have is surgery. So in surgery, what they usually do is they either lengthen a muscle or reduce the size of a muscle to align the eyes. So let's look at that. Okay, so again, we're not going to go into anything too in-depth about the surgeries. I would just like to point out a few things. So firstly, as I said, depending on if the eye is turned in, out, up or down, they can adjust these muscles on the eye. We call them the extraocular muscles. We can adjust the one on the outside, the ones on the inside, whether it's to lengthen it or to add on a piece to it. The ones at the top as well, the bottom, or even the one that is attached at an angle to the eye. One of the things to note about surgeries is that they mainly are done on the eyes that have large strabismus angles, as we would call them. And also another thing to note is sometimes when the surgery is done, the person is left with a residual strabismus. Usually we can call them squint as well, but strabismus for the sake of this video. And with the strabismus that is residual or that remains after the surgery, we can then do vision therapy or the orthoptic exercises, as I mentioned, to realign the eyes after the surgery as well. Other than surgery, another option we look at is what we call botulinum toxin or Botox. This helps relax or paralyze the muscle so that the eyes can be straightened. However, this is a temporary fix. Eventually, you have to take another injection and so on. But at the end of the day, as we know, prevention is better than cure. So what do? Simple eye examinations. In terms of children, they can have their examinations around the age of 6 months. You can get them checked out. Then after that, probably 1 year to 3 years, get them checked again, and so on. However, for the adults, as we know, eye exam every 2 years or so. However, if you have some form of systemic disease such as diabetes or hypertension and these other things, you should probably get your eyes checked a little more often, possibly even a year. So now, just to summarize what we have spoken about, As I indicated, strabismus, medical condition where the eyes are misaligned. One eye is looking at the target, the other eye is either out, inward, upward, or downward. In other cases, they can be rotated to a certain degree. It can be caused in kids by muscle problems, nervous problems, facial deformity. It can also be even caused by trauma. However, in the case of adults, we may see the reason being diabetes, strokes, thyroid problems, or even trauma as well. Treatment options: you can use glasses, spectacles, contact lenses. You can even use prisms. We can do vision therapy or orthotic exercises. There's the surgery option. There's the injection of the Botox as well that we can do. Identifying possible strabismus, you can use the light, as I told you about, shine it into the eyes, see where those reflections are within the eyes. Also, another way to identify is simply observing the person's eyes. Does it look like it's a little bit outward, a little bit inward, up or down? You can just observe and you can see if it is deviated in that case. So now I just like to make mention of a patient that I had in school. She came in, and she really came in because her daughter realized that her right eye was actually turning outwards, and they realized that over the past, I believe it was a 2-week period, it keep increasing and going outwards. So she came in to see about it. What the issue that we found was her pressure was actually very high. So she possibly suffered some form of minor stroke, and this caused damage to possibly a nerve or some portion of the brain. And hence, as we know, the nerves will inhibit the muscles, and therefore the muscle probably was paralyzed due to a case of hypertension or high blood pressure, as we would call it. And so guys, I really hope that this video helped you all. I hope it educated in some form or manner. Share it with your family, share it with your friends, raise awareness about strabismus. It may help someone pick it up early, and that will be beneficial to the person. If you need any information about binocular vision assessments locally here in Trinidad and Tobago, you can message me, Instagram, Facebook. Even if you want to do it a more formal type, you can email me as well. And as I leave, I just want to remind you guys, don't forget the new Facebook, the new Instagram. Go there, like, share, let's interact. And particularly for this video, I'd like you all to like it, and in the comment section put something that you have learned through this video, just one fact that you have learned through the video. Share it with me, I'll check it out. So stay safe everyone. I'm out. Peace.